I'm Gennady Bratslavsky, chair at the Upstate Medical Center, University Hospital, and the chair of the Department of Urology. We conducted a study with our medical student, Mickey Doherty, on role of partial nephrectomy in younger patients less than 45 years of age. We studied over 700 patients who were treated by either partial or radical nephrectomy in this young population. And the reason we selected these patients was because there is an ongoing argument about the role of partial nephrectomy, its long-term implications and functional outcomes, as well as implications on the overall cancer-specific survival. And the reason we selected this population was because we tried to minimize the comorbidity that has always been attributed as a major factor in outcomes of these patients. We have identified over 700 patients, and we specifically made a data selection cutoff at 2003. So we selected those patients treated between 1993 and 2003, and we've looked at the cancer-specific and overall outcomes. Not surprisingly, there was no difference between those treated with partial or radical nephrectomy for a cancer-specific outcomes. However, when we compared the overall outcomes, the overall survival outcomes, we have identified that at 5 years there was no difference, but at 10 years there was a superiority of patients treated with partial nephrectomy. The study may argue that although we still did not account for all the hidden biases in patient selection, the study may account for the continuous role of a partial nephrectomy in management of small renal masses. All the renal tumors in this study were purposely selected as less than 4 centimeters in size. And although it is been argued that young patients can easily tolerate a loss of a kidney because they're so young and healthy, it does not appear to be the case. And since we did find that the survival is only observed at around 10 years mark, we may argue that this study has a broader clinical implications for patients who will have expected life expectancy of 10 years or more. So once somebody comes to a practice and they may be older, if they are about to live more than 10 years, it may make most sense, at least looking at this data, to offer them a partial nephrectomy.